Hi, my name is Nicole Perazzo. I'm going to be doing a pregnancy exam. This is Emily. Emily, do you consent to having this video uploaded to Olivet?
Yes.
Can you just repeat after me? I, Emily,
Emily,
approve of this video being uploaded to Olivet
approve of this video being uploaded to Olivet
and being used for school purposes.
and being used for school purposes.
Thank you. We're gonna go ahead and scan the room. This is my note card. Okay. First off, I'm gonna go ahead and get this exam started and wash my hands. So here, I'm washing my hands. Okay. And then I just introduce myself to the client. Hi, my name is Nikki. I'm going to be your nurse. I'm going to be doing an assessment on you and your baby, okay? First off, we want to make sure that the room is comfortable, warm for the client. We want to make sure that they empty their bladder first off, okay? This client here, she is a Gravida 1, Para 0. She is, we have to note general appearance, so we're noting her emotional state. We're noticing any distress, if she's, her nutritional status. Then we're also going to go ahead and note her vital signs, which we got in the beginning. So her blood pressure is 114/78, heart rate 90 and regular, 100% on room air, 18 respirations, a temperature of 37. Her BMI was 27.5. She's 162 centimeters tall, and she is 14 weeks pregnant at this time. So we're going to go ahead with the assessment. We're going to go ahead and inspect the head. So we're going to go ahead and notice hair distribution on all over her head, her face, look for any hair truism, anything like that, making sure that there's no extra places filled with hair. We can also look for any colicism, like any dark spotting or pigmentation on the face, which sometimes happens in pregnancy. Next, we're going to also note the eyes, so we're going to look for pallor. I'm just going to grab my light just to make sure that we have a good picture. Notice for any jaundice pallor. Go ahead and look up, and I'm just going to shine a light. Here we go. Okay, good. And her eyes are completely normal, pink, appropriate. Next, we're going to go ahead and notice, we can notice the teeth, gums, and also the nose. So we can also grab, we're going to use our ophthalmoscope, make sure that it's working. I'm just going to look inside your nose real quick. We're going to notice the septum, make sure it is pink, moist. Okay, good. I'm going to go ahead and look into your teeth, your gums. Notice any bleeding, anything like that. That's at the tongue. Good. Good moisture. She looks really well hydrated at this time. After that, so we inspected the hair, eyes, nose, and mouth. We're going to check the thyroid. So I'm going to go ahead and palpate. I'm just going to move your hair to the side. Okay. So here she's got a very supple neck, normal, no mass, anything like that. We can do a swallow screen. You swallow and check the size of the thyroid, which is normal at this time. Thank you. Next, we're going to move on to the thorax and lungs. She's not having any respiratory distress at this time, no nasal flaring, no respiratory distress. She's not labored. We're going to go ahead and start looking at your back. So here, I'm just going to move your hair, I'm sorry. It's okay. We're noting her respiratory rate is 18. We're going to start off with percussing and noticing any diaphragmatic changes in her lungs back here. Usually, with advancement of pregnancy, it gets a little bit harder for pregnant patients to breathe because the baby is moving up, moving the diaphragm. Here, not that case. She is breathing normal, non-labored, not having any troubles breathing. So here, we can also auscultate lung sounds, make sure our equipment's clean, and we're listening from the apex. Good. We're listening bilaterally for any bronchi, wheels, crackles, noting each breath sound from the top all the way to the bases on each side. Good. One more good one. Good. Next, we're going to go ahead and move to the anterior part of the chest. So here we're inspecting and palpating as well. So we're just looking here, noticing any diaphragmatic changes as well at this point. There's no use of accessory muscles here, no intercostal breathing. She's comfortable at this time. We're going to go ahead and auscultate lung sounds again, noticing any wheezing, bronchi. I'm going to move your hair again, okay? Okay. Thank you. We're going to start at the apex. Good. Noticing clear lung sounds on each side. Watching the patient breathe at this time. I'm just going to move under your breast. Good. And one more. Good. Next, we can also do a cardiovascular, so we can palpate the PMI here. So it's going to be fifth intercostal, and we can assess that right here. I'm just going to be touching. Okay, good. So here we can also listen for cardiovascular sounds with our diaphragm and bell. So we want to make sure that there's no murmurs, no mammary souffle, so aortic, pulmonic, Erb's point, tricuspid, and mitral. And we're also going to listen with the bell. The aortic, pulmonic, Erb's point, tricuspid, and mitral. And here S1, S2 are auscultated. There is no murmurs here. Next, we're going to go ahead and move on to the breast exam. We are going to defer that, but here we're going to note the size, the symmetry, the shape. We're also going to look at the nipple color as well. We can do a nipple compression here, make sure there's no abnormal discharge or anything like that. So we just press gently down on the nipples and watch for any discharge at this point. Next, we're going to go ahead and move on to the lymph nodes. So here we're just noting size, shape, note for any tenderness. I'm just going to be feeling. So we're doing pre and post auricle, cervical, chest, and axillary as well. Okay, armpits, and we can do a renal after for the exam. Next, we're going to go ahead and do the abdomen. So I'm going to have you go ahead and lay down in a semi-sitting position. Okay. So here we're inspecting the abdomen. We want to note any linea nigra here, any striae, any abnormal movement here. We're noticing also fundal height, and at 14 weeks, we can start from the pubic bone, and we're going to move up, and we're going to palpate for the top of the uterus, which is the fundal height. So she is at 14 centimeters. Next, we can also go ahead, after we're done inspecting, we can palpate for organ and masses. So we're just going to do some light palpation of the abdomen here in all four quadrants, noticing any fetal movement and any uterine contractility at this time. After that, we're going to go ahead and do fetal heart tones. At this time, we are going to defer this because we do not have a Doppler to measure the fetal heart tones, but if we are going to be doing one, I would ask the client to hold her hand. I would feel for a radial pulse. Note that, and then we're going to go ahead with the Doppler, make sure we're draping the genitalia at this time, and we're using the Doppler, and we're making sure we can hear the heart zones comparing, making sure it's not a pulse, the patient's pulse, but the baby's heart rate at this time for 14 weeks, which should be 120 to 160 at this time. After that, we are going to go ahead and also defer a genitalia exam, so that is internal and external. So for the external, we would be noting any Bartholin or skews cysts at this time. We're noticing any labial varicosities, rectoceles, cystoceles at this time. We're looking internally as well, so we're going to note the cervix. We're going to note the color, the closure, the moisture as well for the internal. After that, we can go ahead and do a pap smear. If the patient's concerned for an STD, STI, we can get this checked at this time by doing some swabs and have the patient following up with that here. After that, we're also going to defer a rectal exam. So here, we're noticing the rectovaginal septum, making sure that there is no perforation, anything like that. We're just noticing any hemorrhoids, anything like that. Notice just the color, moisture as well. And then after that, when we do a bimanual exam, we are going to go ahead, notify the client that we will be inserting our fingers inside of them, checking the vaginal walls. We will be making sure that we can make sure that the cervix is closed and pressing down and feeling on their stomach. Then we can also go ahead and have you sit up, and we can check, we're going to check the patient's legs, so we're noticing for any edema here. So I'm just going to feel lightly on their legs. She has no edema at this time. Nothing in her ankles. We can also feel for pulses, pre and post tib. There's no edema present. We can also check for deep tendon reflexes, which lets us identify for any difficulties with her calcium or preeclampsia, anything like that. So we're going to go ahead and have you relax your legs. Okay, and we're going to test your reflex, sorry. Here. There we go, okay, good, good, good. Okay, and then our last step for this is we are going to check for Leopold's maneuver. So I'm gonna ask if you can go ahead and lay down again. And we're gonna do, there's 4 maneuvers for Leopold. So the first one, she is only 14 weeks, so it's a little bit harder to do this. But for full term, like 30 plus weeks, we can actually feel the baby. So we're gonna use the palmar surface of our hands, and we're gonna feel down for the first part of Leopold's maneuver, and we're gonna feel here for the butt and usually the feet. I wanna make sure that they're in position if they're not breached. And then the second Leopold maneuver, we're gonna feel for the sides. So we can note any hands, elbows, the back, right here. And then the third one, we are going to palpate for the baby's head, making sure that it is down. Okay, and then for the fourth one, we're gonna go ahead, touch, make sure the baby's head is flexed and extended here, and then have the client sit up, and then that will complete our pregnancy exam for this week. Thank you.